Hi, today I am going to explain the pharmacology of flucytosine. Flucytosine comes under the anti-metabolite category in antifungal drug. Chemistry wise, it's a pyrimidine analog. So the next important one is mechanism of action. Before going to discuss the mechanism of action, we must know some basic thing. You just imagine any microorganism, either it is a bacteria or fungi, whatever it is. If it is once it is entered into our body, it started to multiplication. It's multiplied into several number of folds. The all cells are unique physical nature and genetic information also same. That means during cell cycle, it's going to pass the same genetic information. The chromosomes or genetic information all are same. That means during cell cycle, the DNA, that means chromosomes also is going to replicate, it's going to pass into the next generation cell. The chromosomes are nothing but it is just a DNA chain. The DNAs are, it's a sequence of base pair. So the base pairs are majorly divided into two categories. One is purine derivative and pyrimidine derivative. The purine derivatives are adenine and guanine. The pyrimidine derivatives are cytosine, thymine in DNA and uracil in RNA also. So that's a basic thing. Next, we can come back to the mechanism action of flucytosine. Flucytosine, it's a pyrimidine analog. So once it's entered into the systemic circulation, after that it's going to reach the fungi cell. So it's entered into the fungi cell via cytosine permease. Once the drug is entered into the fungi cell, immediately it's converted into the 5-fluorouracil and 5-fluorodeoxyuridylic acid. The active metabolite 5-fluorouracil is going to bind with the DNA chain instead of the real DNA base pair. So the end result is going to inhibit the DNA chain elongation, it leads to cell death. Apart from that, 5-fluorodeoxyuridylic acid is going to inhibit the thymidine synthase enzyme. That enzyme is responsible for the synthesis of thymidinic acid. It is one of the nucleotide in DNA chain. So it's going to act on the double way mechanism. One side is going to combat the pyrimidine nucleus in DNA chain. At the same time, it's going to inhibit the production of pyrimidine base pair. So that's a mechanism. The next one is pharmacokinetics. Pharmacokinetics wise, it's rapidly absorbed from the oral. The bioavailability is around 80 to 90%. Even though if it is entered into the systemic circulation, it's capable to bind with plasma protein. Around 30% of drug is going to bind with plasma protein. It's metabolized in liver. It's converted into the active metabolite 5-fluorouracil. Once the drug is inactive, it's going to eliminate it through urine and feces. The next one is adverse drug reaction. The toxicity of the flucytosine is very less when compared to the amphotericin B. Apart from that, the active metabolite 5-fluorouracil, it's having anti-cancer property. So it's having a own side effect. It's going to produce the bone marrow depression, but it is dose dependent manner. Apart from that, it's going to produce some gastrointestinal disturbance like entities and diarrhea. Mild liver dysfunction has been reported, but it's also reversible. The next one is spectrum. Our drug flucytosine, it's having a fungistatic property because it's going to arrest the cell cycle. That means cell replication. It doesn't going to act on the existing cell. So that's a mechanism. So because of that, it's having a fungistatic property. Even though it's a fungistatic, it's effective against only some few strains. Example, chromoblastomyces and tarla and cryptococcus and a few strains of candida. Apart from that, it doesn't having any effect on other fungi and bacteria. So the next one is therapeutic usage of flucytosine. I already say that our drug is effective against some few strains. So it is effective in the treatment for those strains. So it is effective on the treatment for chromoblastomycosis. Apart from that, it is effective against the cryptococcus. So it is used in the treatment for meningeal and non-meningeal cryptococcosis condition. Whenever it is prescribed along with the amphotericin B, we can achieve the synergistic action. If we are prescribed for the deep invasive mycosis condition, the rapid development of resistance has been observed. The therapeutic dose is 250 mg and 500 mg. I hope you got some information from this video. So if you have any doubt or clarification or critical comments, feel free to write in comment section. Thank you for watching.